Pennsylvania Secretary of Health, Dr. Deborah Bogan.
I stand before you with a heavy heart to discuss news that no public health official and no physician ever wants to deliver. As you heard the governor say earlier today, the Pennsylvania Department of Health reported that 2 Lancaster County residents with measles have died. Out of respect for their privacy, we will not be releasing additional personal details. Protecting the confidentiality of residents is a core responsibility of the Department of Health. My deepest sympathies go out to the families, friends, and communities who are mourning the death of these residents.
So far this year, there have been 393 confirmed cases of measles in Pennsylvania. That is the highest number of measles cases since 1992. Nearly 20% of those cases have resulted in someone being hospitalized. I want to be clear, this illness and death from measles is completely preventable. We already have the tools to protect ourselves and our families from this disease, which is one of the most contagious diseases on the face of the earth. Thanks to science, we have a vaccine that can keep us safe from measles and provide a lifetime of protection. And when more than 95% of people in a community are vaccinated against measles, that effectively prevents the spread of the disease in its entirety. And let's speak truth for a moment. Folks are spreading skepticism about things like the MMR vaccine without any evidence to back up their claims. That scares a parent who's just trying to do the right thing by their kids. And it plays a role in why so many people right now are getting measles for the first time in decades. When the information we see coming from the federal government in some cases isn't driven by facts and by science, it makes it even more confusing for parents, and that has a serious impact. I do worry about the U.S. Health Secretary or anyone else maligning a particular community or neighborhood or county in Pennsylvania, and it goes back to the answer I just gave to your colleague. Part of the reason why I was late is I've been sitting out in the parking lot talking to Secretary Kennedy, who reached out to me this morning. And while I appreciate his willingness to offer staff to assist us, we think we're able to manage this through the Department of Health. I was very, very blunt with him, and I made very clear that his actions and the rhetoric that's coming from this administration are having a negative impact on communities across America, particularly right here in Pennsylvania, that there's real life consequences to spreading misinformation. There's real life consequences to scaring people and not relying on actual doctors and actual medical professionals to provide unbiased information to parents so that we can make reasonable decisions for our kids. Please take in all the information you can, consider it, process it, and then go speak to an actual trusted healthcare professional to digest that information, to learn from it before you make a decision, before you decide how to proceed. Every parent knows we can't protect our kids from everything. Despite how hard we try, there aren't a lot of guarantees in life. But right now, while measles is spreading rapidly here in the Commonwealth of Pennsylvania for the first time in over a quarter century, this is one thing I'm counting on as a dad. If you're fully vaccinated, you're not getting the measles.